Hello, welcome to my YouTube channel. I am Dr. Hassan. So today we will discuss another important topic, clinical attachment in the UK, how you can get clinical attachment in UK. So we will discuss how to secure clinical attachment in UK in stepwise. What are the right things you need to do before apply for clinical attachments? What are common mistakes? And from where you need to get email of consultants. And the final thing is that how to make a request for clinical attachment. So how to write personal statement, all these things we will discuss briefly. And if you follow these steps, hopefully you will get clinical attachment or observership easily in the UK, which will help you to get uh, NHS job, and also you will get exposed to NHS system. So let's start. Uh, so first of all, the steps you will need resumes or CV, make personal statement which should be modifiable, and the email of consultants in NHS. Okay, so there are a few things you will need to do before clinical attachment, before apply for clinical attachments. So you should make resumes or CVs. It should be very clear, systemic, and concise. So I have seen that a lot of doctors who just come to UK, and their CVs and resumes are not that good. They are just like irregular, and it's not very clear. So it should be very clear, very systemic. Your education, your experience, age, and everything should be in systemic way rather than randomly, and also concise. You should not have like 5 pages. Rather than you will have to 2 or 3 pages is more than enough. So apart from this, you can use your CVs on Europass website. They're really good uh, CV maker. And another website I personally advise you to recommend to make CV is Job Seeker website. So the second thing is just collect email of consultants. Okay, so you need email of consultants who actually working in NHS in different trusts. So for this purpose, you can get their emails on Track Jobs, LinkedIn, and other resources from social media like WhatsApp or WhatsApp groups or Facebook groups. So if you are not aware of consultants' specialty, write name on the Google and add NHS in the end of the name of the consultant. You will find the designation of the consultant. For example, Robert Matthew NHS. Then search, and you will find about the consultant on uh, Google, and you can write. So there are a few common mistakes you should be aware of. So it is important to not always write Mr. with surgeons and doctor with medicine consultants second name. Okay, so what actually the doctors who are not aware of the system. So the surgeons in the UK, consultant surgeon are in the UK usually uh, happy to say them or call them by Mr. Okay, Mr. with their surname, and the medicine consultant usually prefer doctor with their name. So uh, it is better to that whether the consultant is surgeon or medical consultant. So apart from this, along with personal statement, attach resumes. Most of the doctors who applying for resumes, what they do, they don't send their resumes. Rather than they just write their personal statement on email, and then they just send to consultant, and they they say that they cannot they don't get any clinical attachment for like after sending 100 and 200 emails. So it is one of the biggest mistake that you should send your resumes or CVs along with your personal statement. Okay, and reminder emails on weekend. For example, if you email a consultant 10 consultants throughout the week, then at the end of the week you will have to, on weekend days, you will have to uh, send them a reminder email, because the consultants sometimes they are very busy and they cannot like respond to your first email. So it is also advisable that you should have reminder emails on weekend days. So another point, make a good personal statement which should be modifiable according to specialty. Some specialty they ask for future interest, for example, psychiatry. Okay, for example, if you want to do in psychiatry, there's few trust or consultants or HR will ask you for special interest in psychiatry. Then they will give you um, uh, clinical observership in psychiatry after all these things. So whenever you write a personal statement, it should be like little bit modifiable. For example, if you want to go for acute medicine, emergency, or medicine or surgery, so you will have to little bit change accordingly with the specialty which you are applying for. For example, if you are willing to do clinical attachment in emergency department, you will have to write about the acute medicine, your interest in acute medicine. If you are willing to do in surgery, then you will have to show interest in surgery. So in personal statement, you will have to write about the specific specialties. So it should be modifiable, not like a rigid one. Okay. So how many clinical attachments should you uh, do while you are in the UK? So it is better to prep at least two attachments while in the UK. So one is medicine or medicine allied, or one is in surgery or surgery allied. Okay, and it should be like 3 to 4 weeks. It's better. If you could not have time, then 2 weeks is good for every rotation. So so that you will understand the system of that trust and overall NHS, and you will also find good references from the during your observership, and you can get the references while applying for the jobs in the later. So if it is possible, if it's possible, you can do more attachments. For example, apart from medicine and surgery, you can also do 1 week or 10 days or 2 weeks attachment in emergency medicine or psychiatry. This will also boost your CV, and obviously this will also help you to get job. It's not like 100% surety that you will get job, but most of the trust you are working with them during clinical attachment, they usually offer uh, you job if you are doing well during your clinical attachment time. So in addition to that, if you have like 2 3 attachments in NHS, so it will obviously make difference. So uh, if you need email of consultants, you can always comment down, and I will I can share you some emails of different consultants, different trust, so you can apply. If you need anything else regarding clinical attachment, uh, any information, you can always leave a comment below. So take care. Bye bye. Hopefully this video will be useful for you.